Bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to answer questions about the COVID-19 pandemic. Nous sommes ici aujourd'hui pour répondre aux questions relatives à la pandémie de COVID-19. My name is Sébastien Tremblay, and I will be your moderator. Je m'appelle Sébastien Tremblay, et je serai le modérateur de ce point de presse. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today, we will be hearing remarks from le Maire, Jim Watson. Available from questions from the media following the statement, we also have disponible pour répondre aux questions des médias, nous accueillons aussi Councillor Keith Eglai, Chair of the Ottawa Public Health Board, le conseiller Keith Eglai, Président du Conseil de santé d'Ottawa, le Dr. Brent Maloney, Deputy Medical Officer of Health, médecin-chef en santé publique, Anthony DeMonte, General Manager of Emergency and Protective Services, Directeur général des services de protection et d'urgence, and Chief Peter Slowly, Ottawa Police Service, Chef du Service de Police d'Ottawa. After we hear from the panelists, we will take questions from the media. We will begin now with remarks by Mayor Jim Watson.
Thank you very much. Merci beaucoup, and good afternoon, everyone. Bonjour tout le monde. Thank you for joining us for this media availability. I'll keep my remarks brief, as you surely have many questions related to the most recent announcement by Premier Ford and the Government of Ontario just a few moments ago. To be frank, the situation before us is dire and chilly, to say the least. Pour être franc, la situation que nous attend est effrayante. We don't have all of the answers that you may be looking for. We're still waiting in many instances for regulations to be approved by Cabinet. So I hope you will bear with us. We'll give you as much information as we have, and we'll have to keep you posted as more information becomes available by and from the provincial government. The steep rise of cases and hospitalizations in Ottawa and across Ontario are alarming. We're now in a situation where our hospitals and medical community are stretched beyond their limits. Now is the time for more compassion and less anger, more cooperation and less irresponsibility by those few who continue to flout the rules. As we heard earlier in the week, CHEO is now taking adult patients for the first time in their 47-year history. The new restrictions put in place are difficult, but ultimately needed. Les nouvelles restrictions mises en place sont nécessaires. We will wait for further details from the province, as I mentioned, on how they will be operationalized and enforced. This includes details around how the border checkpoints will work between Gatineau and Ottawa. But let me repeat what the Premier stated this afternoon. These are legitimate reasons for traveling between Quebec and Ontario: work, medical appointments, and the transportation of goods. This is not the time to head to your cottage or to go for a hike in Gatineau Park. Now, despite reaching the milestone of over 250,000 vaccines administered in Ottawa, this will not get us out of the current wave we're facing. We can only get through this by following public health guidelines. This means stay home except for essential reasons, limit your close contacts to those in your household. If you're in a situation where you're with others from the household, your household should all be wearing masks. And when it is your turn, please get a vaccine, whichever one is offered to you. Essential construction projects have also been listed, and we're very grateful and appreciative of the fact that transit, including our LRT and roads projects, are deemed essential under the province's regulations. So there'll be no interruption in those particular projects, which are vitally important to our well-being here in the city of Ottawa, and obviously to the well-being of those people who are relying on transit. I know everyone is exhausted. We just want to return to normalcy. The sooner we can get collectively follow these guidelines, the sooner we can get back to normal, maybe even have a somewhat normal summer. So thank you, merci. Nous sommes disponibles pour répondre aux questions. I'll be happy to answer questions. Please direct it to one of my colleagues or myself, and we'll hand it back to Sebastian. Merci.
Thank you, Mayor Watson. I will now invite questions from each agency alphabetically. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. We will now start with Amanda Pfeffer at CBC Ottawa.
Hi. I guess the question, I understand that you're not, you don't have the regulations for the bylaw and police powers and enforcement. I assume they'll probably be similar to the ones in last spring. I don't know, but can I ask this question? Can you tell me how, what challenges they may pose for officers interacting with the public, and what you're thinking about now in terms of how that could look on the ground? What can you tell us about that, even despite the fact that you don't have the actual regulations?
With your permission, I'll take that question. Thank you for it. I think your caveat at the beginning is a core of my response. Right now, my commanders are getting a briefing from the Solicitor General, the technical briefing on the details of the new and expanded powers. I suspect it will be different from what came up last year. Until we know what that difference is, I can't really give you any sense of how they'll be applied and implemented here, except to say that we will continue to support the city, in particular Ottawa Public Health leadership, on this public health crisis, and make sure that all of our efforts are aligned with Dr. Betches and the team, recognizing the heightened state that the mayor talked about earlier on. We'll do our best in our part. But right now, until we get a proper sense of the technical nature of the expanded or new powers, purely speculation at this point. Answer your question.
Chief Slowly, just a word. We're having trouble with your microphone, so it might be easier if you get a little closer to it next time.
I'm not sure it's just that, but I'll do that.
Amanda, your next question?
I think Amanda's on mute.
Yeah, Amanda, you're on mute. Do you have another
Sorry
question?
about that. Sorry,
Okay.
yes, I do.
Okay.
And unfortunately, it's also for Chief Slowly with your crappy sound, so I apologize. But I'm also wondering about the checkpoint enforcement, and would that be Ottawa Police in this case? And there had always been some wringing of hands of doing that from our side. What questions do you have about how that will look on the ground?
Try using the headset. Hopefully that's a little better. Amanda, this might be
Chief Slowly, we can't hear you.
okay.
Could be.
Can you hear me now?
Oh yeah, that's better. Yeah.
Oh yeah. Amanda, could you just repeat again your question?
Yes, the question is to the mayor and to the chief. We had always had a bit of wringing hands about trying to do that from our end to enforce the border between Ottawa and Quebec. Wondering if that would be your law enforcement agency that would be tasked to do that, but also both the mayor and the chief. What's running through your minds as you hear that you may have to be doing that?
You want me to go first, sir?
Chief, go ahead.
Okay. Amanda, right now, it's going to be a combination of resources. For the provincial level, the Ontario Provincial Police will handle most of the border crossings between Manitoba and Quebec. But municipal agencies like Officer have been asked to take on, other than the main access points through 417, all the other access points. Again, we're still in discussions right now with our OPP and NCR partners, including the RCMP, to see how we would combine those efforts. But the majority of it will fall on the operational requirements of the Ottawa Police Service. Again, very early state to be able to tell you what the
Thank you, Amanda, for the question. there's no doubt that Ottawa Police will take the lead, but also my expectation is that the provincial government, because they're bringing forward this requirement, should be reimbursing the Ottawa Police Service. So it should not be up to local taxpayers to fund a checkpoint at an interprovincial bridge. And the expectation is that the province would pay for our cost, because it's going to require significant person power, because obviously there are 5 crossings with 5 bridges. One is shut down for construction, so 4 bridges for the next 5 weeks. Thank you.
Monsieur le maire, est-ce que c'est possible en français là-dessus, s'il vous plaît?
Oui, certainement. C'est probablement le service de police d'Ottawa qui est responsable pour les checkpoints sur les ponts. Ça va coûter beaucoup de l'argent parce qu'il y a 5 ponts, 4 actuels qui est ouvert pour le moment. Et on va déterminer tous les coûts. Et l'intention est pour la province de l'Ontario de payer les factures pour le service de police d'Ottawa pour cette activité sur les ponts. Merci.
Merci.
Thank you very much, Amanda. We will now move on to Eric O'Brien at City News. Eric?
Yes, thank you. My question is for Mayor Watson. My first question, just to get your, first of all, your general thoughts about a checkpoint being set up again between Ottawa and Gatineau.
Yeah, as you know, Eric, I've never been a big fan of the checkpoint system. I spoke against it when the Quebec Provincial Police and Gatineau Police were doing exactly what we're going to have to do starting later this weekend. But at the end of the day, the province has that responsibility. And both Mayor Pedneau-Jobin and I have talked just a few moments ago. And we reiterated our messages that we're going to encourage people not to go to Gatineau for the next 5 weeks. And he will do the same to encourage Gatineau residents not to come and visit Ottawa unless it's for those 3 reasons that the Premier listed, namely medical reasons, work reasons, or the transportation of goods and services across the border. Thank you.
En français là-dessus encore, s'il vous plaît, Monsieur le maire. Merci.
Oui, certainement. J'ai parlé avec Maxime Pedneau-Jobin et le message est clair. J'encourage les résidents de rester à cette côté de la rivière. Ce n'est pas le temps de visiter le parc Gatineau ou une autre activité à Gatineau, au Aylmer ou Hull. Et la même chose pour M. Pedneau-Jobin. Il dit que ce n'est pas une bonne idée de visiter Ottawa pendant les prochaines 5 semaines. Mais à la fin de la journée, c'est la province qui a décidé de commencer un checkpoint. Je pense que c'est dimanche à minuit. Et on va suivre ce règlement. On n'avait pas... c'est la loi de la province de l'Ontario et c'est nécessaire pour nous autres de suivre ça. Mais comme j'ai dit, ça va coûter beaucoup de l'argent parce qu'il y a 5 ponts. Et si les heures sont les heures de 24 heures par jour, je ne sais pas, mais ça va coûter beaucoup de l'argent pour M. Slowly et son équipe. Merci.
Thank you. As my follow-up question, it's actually for Chief Slowly. So the Solicitor General mentioned earlier that fines would be around $750 for those breaking the rules. Now, I just wanted to know what will be the criteria in Ottawa for giving out fines? How will that work?
Yeah, thank you very much for the question. Again, the technical briefing for the new regulations is being provided right now. So I just can't speculate on the nature of what the grounds will be and how the legislation is laid out and how that will be applied here in Ottawa, except to say we'll continue to make sure we do our very best to provide the support for the overall public health strategy that's going on.
All right, thank you, Eric. We will now move on to Josh Pringle at CTV Ottawa.
Thank you very much. My first question is for Chief Slowly, and I'm just going to ask a little bit about what the CBC question was because your audio sounds a little bit better. If I understood correctly, you believe that Ottawa Police will be responsible for most of the patrolling along the 5 interprovincial crossings in Ottawa. Any idea if there'll be 24-hour checkpoints or you just do sporadic? And also, do you have staffing to be able to handle this over the next few weeks?
Yep. Thank you. Again, we're waiting on the full briefing. My initial understanding is it is intended to be on a 24/7 basis, and will carry on for several weeks. That will be a significant staffing challenge for us. We're still in discussions, again, waiting the details, but in discussions already with the Ontario Provincial Police, our counterparts in Quebec, irrespective of whether they have a similar mandate around the border, as well as with our NCR partners, including the RCMP. But is a still unfolding set of regulations and expectations. And so anything further than that would be just speculation at this time.
And my follow-up question, I guess, would be for Mr. DeMonte or Dr. Malakny. Earlier this week, you speculated on a possible Section 22 order for Ottawa parks. Is that now no longer on the table since parks are closed?
Perhaps, Josh, I'll start. So I think with the government's announcement this afternoon, we need more details as to exactly what regulations and restrictions there will be for parks. So we're going to pause on our Section 22 and take a look at what the government has instituted, and then see if there are any additional restrictions or recommendations that are needed once we have a chance to take a look at that.
Tony, do you want to maybe mention, it's our understanding that parks are not closed, but amenities of parks such as the basketball courts and play equipment are, but people can continue to walk through the parks. Is that correct?
Yeah, yes, Mayor. Like you and as Chief Slowly said, it's early days. We haven't seen the regulations, and that really is in all these cases the devil's in the details. So we're waiting to get from Solicitor General what we heard on the announcement. It was that the parks, the amenities are all closed, like basketball courts, that type of thing, but the parks would remain open, and people can go through parks as long as they're within their family groups. But again, that's preliminary information, and I don't want to go any further because I also would be speculating, but as the mayor indicated, it looks like that seems to be where we're going. And as soon as we have more detail with our public health partners and police and our city partners, will make sure that that information is clear and the public is well aware of what is open and is not.
Thank you, Josh. We will now move on to Craig Lord at Global Ottawa.
Thanks very much. I think this would be for Chief Slowly, but also Anthony DeMonte in terms of the bylaw side. The news about the increased police powers is likely quite troubling to a lot of Ottawa's Black and racialized residents. So how you make sure that officers aren't using these new powers to stop residents just out in public and wield them in an over-the-top manner against Black and Indigenous and racialized residents.
Greg, thank you for your question. Again, without understanding the detailed technical nature of the new regulations, again, I'll be speculating as to what those powers are and how they should and could be applied. Irrespective, the need to maintain public trust in a public health or public safety crisis is critical. The mayor said it, I think a number of other speakers have said it. Without the actual consent and cooperation of the public, this is not going to work, no matter what we do from a health standpoint or a safety standpoint, whatever we do from an education, engagement, or enforcement standpoint. If we can't get people to trust in the institutions, the information they're hearing around the risks associated to the health crisis, then their compliance or non-compliance is mute. So whatever the regulations are, we're going to try to apply them in the most ethical, legal, and effective way possible. Again, we'll do it within the larger public health framework as opposed to a purely enforcement-based standpoint. But we don't know the details of the legislation. We don't know the extent to which the law has changed, whether those new powers align with things like the street check regulation, human rights legislation, even charter legislation. It is purely speculation at this point as to what those new powers are and how they will impact our operations. All we can say is we are very aware of the issue of public trust and confidence. We are very aware of the level of trust and confidence, specifically with our local racialized and Indigenous and Aboriginal Inuit communities. And we'll do our very best to understand, explain, and apply those laws, again, ethically and effectively, legally, of course, and in a way that is as transparent and as consistent as possible, all with the goal of improving health outcomes for every member of the community.
Yeah, I don't really have much to add. Again, we want to see what the new role is, but certainly on the additional powers, it seems to be more directed towards the police service with regards to additional powers. Bylaw will be adapting our enforcement based on the new rules that have been put in place. But I echo Chief Slowly's comments. This is a public health emergency, and we said it at this conference and others. I think it's individuals that we all have to assume our responsibility and do the right thing. We can't enforce our way out of this pandemic, but we can work together towards achieving our common public health goals.
Thanks very much. I think my follow-up would be for Dr. Malakny and Mayor Watson if he wants to weigh in. But what is the message to Ottawa residents right now when they're attempting to balance their health at their mental health at the peak of the pandemic, and are now worried that they potentially might be subject to a fine just for walking around outside? What is the message to residents in terms of morale and in terms of behavior and making their way through this toughest stretch of the pandemic?
Yeah, no, certainly, as I described earlier at the technical briefing earlier this week, I mean, certainly we're in a serious situation with respect to the COVID transmission and the trends that we're seeing here in Ottawa. We've seen a response by the provincial government with a variety of stricter measures. And I think it's understandable that people would respond in various ways, of whether it be anxiety or fear or anger or what have you. I mean, there's just different kinds of reactions that different people will have. I think it's important, first off, to remember that there are things that people can do. So similar to Mr. DeMonte's comments just prior to this, in terms of the actions that we can do as individuals and as families to protect ourselves from transmission from COVID, to stay with our families, to only go out for essential reasons. There are our understanding provisions for essential reasons, and physical activity is one of them, and it is important for people's mental health. It's important for getting physical activity for their physical health as well. Certainly, we would recommend that as people go out, they bring a mask with them, so that if there's other people around on the path or in the park or on the sidewalk, and it's becoming crowded, that they wear their masks. If the people's feelings are such that that they're becoming quite significant for them, it's important to recognize it's okay not to be okay. And there's resources on our website for people's mental health. There are mental health crisis lines if one needs to do that as well. But we're in a serious situation. The government has decided on a number of strong public health measures to try and push this down as quickly as possible. But it's okay not to be okay. And as I said, there are a number of resources that are available to people to help support their mental health.
All right. Thank you, Craig. We will now move. On va maintenant à Boris Proulx avec Le Devoir. Boris?
Bonjour, Monsieur le maire. Il y a, dans l'annonce du gouvernement Ford, il n'a pas été mentionné les déplacements pour des raisons humanitaires. J'aimerais savoir si il est compris que les gens pourraient se déplacer entre Gatineau et Ottawa pour des raisons humanitaires.
Oui, Boris, je n'ai pas une réponse pour toi. On attend des règlements de la province. M. Ford a dit dans son conférence de presse les raisons de travail, les raisons médicales et de transportation des des produits, etc. Alors, on tente les règlements. Est-ce que votre question est une partie de les raisons médicales? Peut-être oui. J'espère que ça, c'est le cas parce que c'est vraiment une période très difficile pour des personnes qui habitent à Gatineau et peut-être avaient une personne à un hôpital avec COVID-19. Alors, j'espère que la province est raisonnable au sujet, mais pour le moment, je ne sais pas.
Vous avez dit tout à l'heure que vous n'avez jamais été un grand fan des barrages. Vous avez dit ça en anglais. Si M. Ford vous avait consulté, vous lui auriez dit que vous n'en vouliez pas de barrage, que vous aimeriez plus la libre circulation?
Non, il n'y a pas de consultation avant ça. J'ai entendu une rumeur hier, mais aujourd'hui, il a annoncé la décision et comme j'ai dit en anglais, c'est la loi de la province de l'Ontario. On n'avait pas beaucoup de choix. J'espère que ça va aider la situation et réduire les nombres de cas de COVID-19, mais ça coûte beaucoup de l'argent et certainement, ça prend beaucoup des agents de police si ça c'est un barrage 24 heures chaque jour. Merci.
Merci.
Merci, Boris. We will now go to John Willing at the Ottawa Citizen.
Thanks, Eb. This question for Dr. Malakny. Doctor, it didn't sound like the health unit this week was moving to close amenities, but instead institute mask rules and capacity limits. So I'm wondering if you think the province's move to close amenities is going a bit overboard.
Thanks, John. Certainly, as you said, I mean, our intent here in Ottawa was to address the crowding that we were seeing in some of the amenities in parks in recent weeks, and our approach here in Ottawa was to recognize that we wanted parks open. We wanted a place for people to be able to get out into the outdoors. Not everyone has a backyard. It's important to have an opportunity to go outside for physical activity and mental health purposes. And our initial approach was to, as you said, was we had planned to have some capacity limits on some of the venues that were a little more crowded, and have mandatory masking in venues and around them, because there was also an issue with people watching and observing or waiting to use them. The government, has decided to have strict measures, to address the situation that they've seen in the province, and there is a science table that's been advising them on the evidence. And we'll need to see, as we've indicated, which venues or which amenities are in fact included. They've mentioned a couple of them, but we'll need to see the full scope of what's included. And as I indicated earlier, I mean, if there are some amenities that we had identified that we also thought that needed either capacity limits or mandatory masking, that the province is going to remain open, then we'll look at a Section 22 order to do that. But we really need to see the regulations to know exactly what the province has ordered.
Thanks, Doctor. Just a follow-up. Based on your knowledge of the people being tested and testing positive for COVID, are there many workplaces operating in our city that you believe shouldn't be operating? And if so, of course, we'd be happy to hear some details about that too.
Certainly at this point, anywhere where people are interacting, there's opportunities for transmission. So in recent weeks, as this resurgence has built ground, we've seen a number of workplaces with transmission, because having people coming into the workplace provides that opportunity if people are not distancing and wearing masks. And one of the challenges when people are in workplaces is they let down their guard with their colleagues, whether it's at the break time or during meals or sometimes carpooling, that sort of thing. So we've seen transmission in a variety of settings, whether it's in the food service industry, in healthcare, we had been seeing it in sports teams until they had stopped. So so again, in a number of settings, also office settings. So there are probably some within that group that may not be absolutely essential, and I think the government has put the onus on workplaces, from what I understood from the Premier's comments, and again, when we need to see the regulations, to have strict expectations in terms of only those people that are absolutely required to be at work would actually be there. But essentially, overall, whenever people are coming together from outside their households, there's an opportunity for transmission.
Thank you.
Thank you, John. We will now go to Kelly Egan at the Ottawa Sun.
Hi, this is a question probably for the mayor, a different version of what you were asked in French. Will the police officers have some discretion at the bridge crossings to let people go through for reasons outside those 3 strict definitions that the province laid out? In other words, if I have a reason that I think is essential, maybe my cottage burned down over there, maybe my grandmother died. Mayor, are you hoping that the police officers do have some leeway there?
Yes, very much so, Kelly. I think there has to be that level of reasonableness, because you can't capture in regulations every single personal reason why someone may have to come across the border. And obviously, if a loved one has passed away, or they're in the hospital, or they need their son or daughter's care, that should be a reasonable reason. What we're saying is, look, you don't have to go to the Gatineau Park or get cheap beer at the Dépanneur, but if there's a sensible reason why you should be coming in, I hope that the police are given that discretion. But as Chief Slowly has indicated, I think literally they're on a phone call right now with the Solicitor General going over these details. But generally, and I'll ask Chief Slowly to comment, but generally officers do have an element of discretion. And my hope is that people are not abusing that by making things up, but that if they do have a legitimate, compassionate reason to cross the border, that should be allowed in a civil and kind society. Chief?
Mayor, I think you said it best. Discretion is always there. The challenge will be some level of reasonable verification around that compassionate cause. So again, we're going through the briefing right now, but assuming that there is that ability to demonstrate discretion, the ability of people who are making that request to provide some reasonable validation of the nature of that will go a long way to enable the officer or officers to utilize that discretion.
Just a follow-up probably for the police chief. The Solicitor General really outlined what sound like pretty extraordinary powers for police. It's pretty unclear how this is going to work on the ground. I mean, it sounds like police can stop anybody at any time and ask them where they're going, where they live, and the reason for their visit. I mean, do you anticipate that police are going to be stopping people randomly and asking them to justify their trip outside the home?
Well, the police won't be stopping people randomly. They'll be stopping them in concurrence with whatever the regulation is. That's the challenge, though. We don't yet know what the regulation is. We don't yet know what the scope of those powers are. We haven't yet then been able to turn our mind to how it would be applied. It will never be applied randomly. So I realize it's a pejorative type term, but whatever we do with these powers will have to be lawful. They'll have to be consistent, as transparent as we can translate the powers to the public as to what they are and how they're likely to be applied. And again, just understanding this is a public safety crisis we're trying to make a contribution to. None of our members, all of our members are exposed to the same risks, in fact, many more risks than members of the public by virtue of being frontline service providers. It's our intention not only to keep people healthy, but to be healthy ourselves in the provision of services and whatever education, engagement, and enforcement is required of us. The same concerns that members of the public have our members actually go home and they have time off. They have children, they have parents, they have loved ones, they have sick members of their family. They have members of their family who are struggling with the same emotional and psychological challenges that the members of the public have. They themselves will be the subject, potentially, of interventions by bylaw, by police services of this jurisdiction and other jurisdictions. They themselves live on the Quebec side and will have to transport across the bridges. So we ourselves are subject to not just the deliverers of the enforcement and the powers at the borders, but we are subject to the same things. So it is our goal, irrespective, to be as lawful, as ethical, as compassionate, and as judicious as we can be without yet fully understanding what those powers are.
Thank you, Kelly. We will now go to Sue Sharing from On the City from the Burbs. Sue? Sue, I think you're still on mute.
Sorry about that. I don't have any questions.
Perfect. Then that's all the time we have today. I want to thank everyone for joining us this late on a Friday, and have yourselves a great weekend. C'est tout le temps que nous avons. Merci beaucoup tout le monde.
Merci. Thank you.